Have you ever pondered the mysteries of the human genome? A small tweak in our DNA could yield entirely unique traits. Take, for instance, the Cri-du-Chat syndrome. This rare genetic condition, when translated to English, means cry of the cat. It's named after the distinctive cat-like wail of babies diagnosed with it. The cause? A missing piece in the short arm of chromosome 5. Hence, it's often referred to as the 5p- syndrome. Today, we will explore this intriguing condition. Cri-du-Chat, or cry of the cat in English, is a rare genetic disorder that gets its name from the distinctive cat-like cry of affected infants. This syndrome is a result of a deletion in the short arm of chromosome 5, which is why it's also known as 5p- syndrome. Now, there are no distinct types of Cri-du-Chat syndrome per se, but the symptoms can vary in severity. Cri-du-Chat syndrome, a rare genetic disorder, presents a complex spectrum of symptoms. The symptoms, though unique to each individual, share certain commonalities. The manifestations may vary in intensity and number, making each case unique. Some patients may show a broad array of symptoms covering the entire spectrum, while others may exhibit only a handful. To be more specific, these symptoms can span from delay in cognitive and physical development, intellectual disability, to behavioral issues that significantly affect the daily life of these individuals. Furthermore, the individuals may also have distinctive facial features that are typical of this disorder. Some individuals might display all the typical characteristics, while others might only show a few. These symptoms can range from delayed development and intellectual disability to behavioral problems and distinctive facial features. What causes Cri-du-Chat syndrome, you ask? Well, the answer isn't as simple as you might think. This syndrome, which is relatively rare but incredibly impactful on those it affects, is primarily a consequence of a genetic abnormality. The human genome, an intricate and complex construct, comprises a multitude of genes that play distinctive roles in our bodies. Occasionally, of this intricate schema goes missing, leaving a gap in the genetic puzzle that forms our unique selves. Cri-du-Chat syndrome is one such instance where there is a missing link in our genetic composition. The cause of the syndrome can be traced back to a deletion in the DNA molecule. This deletion, to be precise, occurs in a specific part of chromosome 5. This chromosome, like all others, plays a role in our genetic makeup, and any aberration can have profound effects. But this isn't a typical genetic disorder that passes down through generations. Unlike most hereditary disorders, the genesis of Cri-du-Chat syndrome doesn't lie in the genes inherited from the parents. Instead, it's an unexpected irregularity that arises during the formation of reproductive cells. It's a twist of fate, a random anomaly in the genetic materials that are the blueprint of life. In fact, it mostly happens as a random event during the formation of reproductive cells. Speaking of risk factors, they remain quite elusive. This is largely due to the fact that the syndrome is not generally inherited, meaning there are no certain and obvious risk factors to identify or trace. It can occur regardless of the circumstances surrounding the pregnancy, and it is not limited to specific populations, races, or age groups. However, it's important to note that it is not, as per numerous studies and research, older parents, particularly those who conceive after the age of 35, might be exposed to a slightly escalated risk. The probabilities may be marginally higher in cases where the mothers are older. This, however, doesn't mean certainty, but a possibility of an elevated chance of having a child with Cri-du-Chat syndrome. Now, moving on to prevention and precautions. Cri-du-Chat syndrome, as many of you may already know, is a random genetic event. This means that it can occur out of the blue, without any clear causative factors. It is thus, unfortunately, a condition that cannot be prevented with absolute certainty. However, this does not mean expecting parents are at a complete loss. There are still certain precautions that can be taken to understand and prepare for the potential risks. One such measure is genetic counseling. This involves consultation with a healthcare professional who can provide detailed information and guidance about potential genetic disorders. Another is prenatal testing, a medical procedure that can detect or rule out certain genetic disorders before the birth of the child. Genetic counseling and prenatal testing can provide information about the risk of having a child with a genetic disorder. Now, let's consolidate what we've discussed. Cri-du-Chat syndrome is a rare genetic disorder prompted by a deletion in chromosome 5. It results in varied symptoms, including physical abnormalities and behavioral issues. It can occur in any pregnancy, but risk factors remain unclear. Genetic counseling provides expecting parents with risk information about this disorder. It teaches us about the complex nature of the human genome, where a tiny deletion leads to significant change. With scientific progression, there's hope for improved understanding and treatment, promising better lives for the sufferers. So stay curious, stay informed, and keep exploring the fascinating world of genetics.